morning, everyone. Thank you all for registering for the 2019 convention preview. We will be taking questions at the end of the presentation, so please make yourself familiar with the question box available on the GoToWebinar login screen. Any questions you have will need to be submitted here. And at the end of the presentation, I will read each question that it is received. And with that, I'm going to turn the presentation over to Donna Hankins and Jimmy Pierson.
Good morning, everybody. Thanks for joining us. We're really excited to talk with you today and preview our convention. It's a new thought for us. Everything's going digital. We've done a lot of webinars this year, but we really want to highlight the reasons you want to take a trip and travel to San Diego to join us for the California Elements Association's annual convention. I want to start by having Jimmy talk about some of the big ideas for it, which is just what the convention is this year. Go ahead, Jimmy.
All right. Hold on. So thank you, everybody, for attending. And hopefully, like I said, if you have any questions, please bring it up towards the end, and we'd love to answer them. But the way we're doing the format is a little bit different. Well, not Tuesday. We're starting off Tuesday with our golf tournament. So I know we have, I think, 12 or 13 people signed up. We want to get more as we can, but it's going to be at the Riverwalk Golf Course. And then later Tuesday night, we have the T-Mobile Home Run Deck. That's going to be the first place Los Angeles Dodgers versus the San Diego Padres. And it's going to be a great time. The food and beverage are included. And we are at the, like I said, the T-Mobile Home Run Deck, which is right above right field. You can be looking right over the field. We did it 2 years ago. A lot of people loved it. And then, and that's just great for, networking and just getting to know our vendors and getting to know the people that are involved with our conference. So we'd love to see you. I'd love to have you come out. Please get your registrations in for that. Tickets are $45 for members and $55 for non-members. And it's just going to be a great event.
One thing we want to point out is for the golf tournament.
Obviously, the conference is going to start Wednesday, and we're going to go through. Hold on, Donna. Sorry.
No worries. One thing we want to point out for the registrations is you need to register for your hotel by Monday if you're going.
Okay. Hold on one second. My computer is. Apologize.
Hotel registration is due Monday, and the golf tournament you want to register for by the 13th because they need an RSVP. If you happen to register and didn't purchase golf or baseball, you can still get a ticket for those events. Just email Kim Moreno.
Hold on, sorry. All right, and then obviously our general sessions are going to start on Wednesday, and they're going to go from Wednesday and Thursday, and we're doing it a little bit different this year. We're having the same 3 tracks, but what we wanted to do is focus on making sure our wonderful vendors got highlighted and made sure we understand how important they are to a successful conference and the products that they have that make all our operations fantastic. So with Wednesday, our Wednesday keynote session, this is, I think these dates are a little off because we start Tuesday, it's Wednesday, Thursday.
Yes. But Wednesday, then Thursday.
Is going to be, our keynote speaker is going to be Eric Tozer, who's the founder and president of the Diabetes Sports Project. And he's going to talk about being the first person with type 1 diabetes to complete the World Marathon Challenge, which as exhausting as that sounds, that's 7 marathons in 7 continents in 7 days. And Eric was a soccer player. He works for a pharmaceutical company now, understands the healthcare industry. And I think just promoting health and wellness and understanding those obstacles that Eric went through as a type 1 diabetic and what he goes through every day is going to be hopefully inspirational for the attendees, and everybody can kind of get to understand what he went through. And I think it's going to be a great topic. We'll have, and again, like I was saying, we have the general sessions, and then we built out operational and reimbursement and executive sessions. but there'll be 3 general sessions a day. Doug Wolfberg is going to be doing the midday general session on compliance and overall EMS topic issues. And then Mike Tagman is going to be completing the general session day with preventing PTSD and talking about some of the products that they did create at First Watch. But I think just overall, one of the top issues in our industry is employee health and well-being and post-traumatic stress. I think a lot of services across the country and our state are seeing employees that have issues and need to have programs that support that. So I think it's going to be a great topic. Our Thursday general session is going to be Matt Zavatsky, and Matt is the NAEMT president, and he is directly involved with a lot of the different payer issues that are going on with CMS and innovative healthcare, not home health, but community paramedics type solutions and MedStar. So Matt's not just the nice thing about Matt is he doesn't just come at it from a perspective of this is operational. He really is on the forefront of payer issues. I was actually just on a conference call with him the other day regarding the new CMS eligibility rules, and Matt is intertwined at the hip. So that's going to be fantastic. We have an EMS in California today. We have Brian Henriksen, who's the Napa County EMS administrator, and also the MSAC president this year, and Todd Valeri, who is our incoming, or I believe going to be the incoming president for the CAA, and also an EMS commissioner. We're still waiting to finalize the rep from the EMS office, the state EMS office. They have committed, but they haven't given us the name. And we want to get a state medical director rep as well. Just trying to get the names, been somewhat challenging. But the goal is to have at least 4 to 5 people on this panel to talk about what our future issues are in California, whether it's centered around reimbursement, technology integration, EOAs, extensions, grandfathering clauses, interactions with our public service providers. So I think overall it's going to be a good topic as a general session for what the future looks like in not just operational, but hopefully reimbursement and those issues that impact ambulance providers on a daily basis. And then with that, we're taking another level to end the day is we're going to have some of the nation's top innovators and not just innovation type technology innovation, but right now there's a big topic. We understand the cost reporting that's out there. We understand, like I was saying, the EMS, the new CMS rules. We have ET3, Matt Zavatsky, Asbel Montez, Scott Moore, Mike Tagman. We did have Brenda Staffen on this panel, but we found out about 3 days ago in a positive note for the CAA that Brenda was hired with CMMI, and she's moving to Washington, D.C., and she'll be starting that job by mid-September, so she cannot be a part of the conference, but she is a great resource that we now have in Washington. So that's really good for us, but now we got to fill her spot. So that's hopefully a good general breakdown of what Wednesday and Thursday's general sessions are going to have.
Thank you, Jimmy. I'm going to jump into talking about reimbursement. This is a great time of the year to escape from the hamster wheel that we're in the reimbursement and come and talk with other providers, what problems they're facing, and get reset for the year that's coming up. So the reimbursement track, first I want to talk about our Wednesday discussions. I'm sorry about the error on the PowerPoint slide before. I was so excited to get to San Diego. Wednesday's discussions, we're going to have, first we're going to do an insurance update with me, and we're also going to do some revenue management. I'm actually collecting a panel of collection agency members and talking with them about the new partnership we want to form with our collection agencies. So we're going to have a great discussion with me and our collection agencies, as well as an insurance update for things that have come up this year and are coming up next year for our big payers. We've also recruited Ed Norwood to come talk with us. He's going to have an appeal writing workshop, and he's going to have a booth at the CAA, and he's going to talk with us about writing our appeal letters. As insurances get tougher trying not to pay our claims, we need to reinvigorate our strategies to try to get insurances to pay. So we're really happy to have Ed Nord with us this year. We're also going to have, once again, we're going to have Asbel Montez and Brian Choate, who's going to do their track trend monitoring bill performance. So we're pretty excited to have Asbel come and speak with us. He's also doing another lecture. Thursday's discussions, we're going to have cost reporting with Asbel again, so more discussion with Asbel, and he's going to speak specifically about the new Medicare cost reporting program. After Asbel, we're going to have our Medicare update with Peggy Sarge from Noridian. So she'll hopefully be giving us some insight into what's happening at Noridian, any changes coming up in the new year, and things that we should be aware of. Along with this, as Jimmy mentioned, Doug Wolfberg is there, and he's doing a couple of different lectures, which is great. And I think a lot of the tracks that are in the general session will be applicable to payer issues, and so we'll want to go ahead and attend those and see what's being presented. So after that, we also have our third track, which is our operations track, Building Better EMS.
Okay, this is Steve Melander. I am on. Can you all hear me?
Yes, Steve, thanks. Welcome.
Okay, great. I oversee the operations track as well as the content committee. And so we're excited to bring some sessions that we think are going to be really helpful for the operations level manager, supervisor, even up to kind of like the general manager level as well on some of these items. So on the first one on Wednesday, we have FirstNet with Brent Williams. So for those of you who are not entirely familiar with the whole FirstNet movement, it's my understanding that Brent is not specific to one of the providers, but more attached to the federal government component of it. And so with the whole FirstNet communications, this is about prioritizing communications for first responders. People are starting to hear about this, and it's starting to become more popular. But there's new technologies that are out there, and it's specific to mobile broadband, and it has to do with and the two big providers out there right now. It seems like you got AT&T's FirstNet, and then Verizon is now coming on board with the First Responder Network Authority, I believe is what it's called. And where this is going to really come in is your ability to make these communications and get prioritization during mass disasters or times when the systems are being overwhelmed by the general public. And then also where this is important and where it ties in, it looks like they're going to talk about the ET3 and our ability to maintain broadband communications for ET3, which is an important component because to participate in that project, you have to have the ability to link up and connect with healthcare providers at the advanced practice level, meaning nurse practitioner, physician assistant, physician, to provide the assessment component for the triage, treatment, and transport study. So I think that there's going to be a lot of good information shared there. We also have a Prop 11 mental health training and access with Ken Katz. Ken's background is he's a licensed clinical social worker. He's also a certified trauma specialist, which means he has all the qualifications to lead critical incident stress debriefings. He provide training to first responders, public safety, as well as EMS providers. He trains all of our local law enforcement in critical incident training and how to specifically work with mental health populations and how for officers to be able to bring situations back under control quickly, especially with patients that have a mental health component associated or are experiencing a psychiatric emergency. So he does all of our training. We're in the process of shooting an entire, we've already shot it, and we're in the final editing process of a video series that Ken led as well that's going to help people meet their mental health training requirements for Proposition 11. And so really what that looks like is what he's going to get into is how to formulate the training but then also how to meet the requirements of the EAP access requirements and the follow-up mental health care, and kind of talk a little bit about what we've done here at American Ambulance to meet that and what resources are available for people out there as well. So I think that's going to be a good one. And then we also have Prop 11 Compliance Part 1 with Corey Cabral and Mark Spring. I actually talked with Corey yesterday, and he had shared that they're going to have two different focuses. They're going to do a operations track, which is Part 1, and then Part 2 is an executive track and that's on day 2. On Part 1, what their main focus is going to be is managing and preventing workplace violence and disabilities. And so when we spoke yesterday, he said that in the state of California, as an employer, once you're aware of a disability, that you need to identify it and you need to make necessary adjustments. And so in addition to the training component of how to respond to active shooter scenarios, whether they're out in the community or actually at your place of employment, and those types of incidents, those disaster type incidents, and obviously active shooter scenarios have been the most concerning as of recent, and kind of on an uptick, it appears to be. And but then also, what effect does that have on your workforce, and what effect long term does that have on specific employees and their ability to respond to those types of incidents? So I think that's going to be interesting. On Thursday's sessions, we'll go back to that slide. Lift injuries. So Rick Binder, he's with the Binder Lift. His father invented this device to help lift patients off the floor and onto the gurney. So we pretty much a lot of providers now have the gurney systems that are the auto assist with the lift, right? That are powered gurneys, but we still have the issue of getting the patient from the floor, from the bed, from wherever they reside onto that gurney. And that is the problem that Binder Lift has solved and that they're working towards. And what was neat is I saw a webinar by Rick Binder, and he is so passionate about the industry and so passionate about first responders being injured and having career-ending injuries and trying to prevent that I was very impressed with his presentation. And what I was most impressed with, it wasn't, hey, here's a 1-hour sales pitch for the Binder Lift. It was all about the industry, all about what's going on, how to prevent these types of injuries, the impact, the cost that it has on people and organizations. So we invited him to come do this session for everyone. The next session is Natural Disaster Response with Brian Meter. He's the operations manager of Medic Ambulance. We specifically chose Brian to do this because he has real life experience. Medic Ambulance is very active in responding to natural disasters. They have a very comprehensive team and a well-organized approach. And in the last few years, they've been activated on some pretty major incidents all throughout Northern California, up to and including the Paradise Fire. And so this Brian will get into how to set up your team, the training components that are also attached to Proposition 11 with disaster response, but then also more specific to natural disaster response and how they tackled this at Medic Ambulance and kind of where they've been and where they're headed. So I think that'll be very helpful for especially the operations supervisors, managers, and strike team leaders and that type. And that concludes the operations track.
We'll let Jimmy take over to talk a little bit about the executive track seminars that we're hosting.
Yeah, thank you. Good job, Steve. That nails it pretty good in terms of operations. So executive track, we have some great speakers on Wednesday and Thursday. Doug Wolfberg always does a fantastic job for us every year, talking about really both reimbursement and executive type topics, even though it may sit in executive. Double documentation is what we're going to be doing on Wednesday, followed by integrated compliance. And if anybody has seen or heard Doug talk, especially about these two topics, you can get really passionate and understand what you need to do better and how you can improve as a provider. And Doug's always been very willing to talk afterwards, before, and he stays for pretty much the entire day. So please, if you have questions or you want to send anybody, Doug Wolper, it's just great information. And then Scott Moore is doing employee retention, and the focus there is to figure out what we can do to increase retention, make sure that we're doing everything as providers that we need to do to keep our employees happy and safe. And I think, as you're going to see with Mike Tagman, we talked about earlier, and some of the topics that you heard Steve talk about in operations, I think they all play a role in employee retention. And Scott Moore, he's presented at our conference before. He's very involved with the American Ambulance Association. He's also an attorney. So he comes from a very good perspective, and more of an HR perspective, and the things that you can do to help increase employee retention. Corey Cabral and Amy Williams, they're with CDF law firm. I don't even try and say the names because I'd butcher them, but they're actually one of Medic's corporate attorneys, as well as many others across the state, and they do a fantastic job. Corey's been involved with some of our workplace issues, and meal and hour compliance, break compliance, and Corey and Amy are going to focus on those other aspects of Prop 11 that we need to know about, and that we need to comply with, and making sure that we're doing everything we can within our industry to give the meals, breaks, and rest periods that we need, and give us ideas to prevent those kind of claims. So I think it's important. And again, they'll be available also for questions afterwards, and they'll be a good resource for our members and our vendors to ask questions. Obviously, we had this on here. This just changed recently. We're working to fill this speaker spot. We want to stick to the ET3 topic. ET3 is the new model being released by CMS. Application due at the end of September. It's triage and transport, I believe, is what the ET3 stands for. But we just know it all as ET3, and it's just a new application process for providing healthcare in a different way, and that we've got CMMI and CMS to look at this and consider possibly giving CMS rate increases. It's a topic that we need to know about. It's a topic that needs to be educated to our members. Like I said, the first round of applications are due, I believe, September 19th. And if you don't get in this time, I know they will be accepting applications after September, but I think into the year too. But so it's just a program that we all need to know more about. We all need to communicate about and get out to our members. And we've got some great speakers, some great topics, not only for reimbursement, but operations and executive, and good speakers that people will keep people engaged. And I know this is my last spot here, but I got to commend Donna Hankins, and anybody who's ever worked with Donna and knows Donna, as she's motivated on reimbursement topics, and she's really helped us get the right people to come talk on topics so that we can have our reimbursement people, our collections managers, supervisors, collectors, billers come to the conference and really get valuable knowledge that will help each one of our organizations. And Steve, I can't say enough about Steve. He has the pulse of what's going on in EMS, and make sure that we have the right speakers. So I think there's a great team behind this conference. Make sure we have all the right topics, speakers, location, and flow. And I can't emphasize enough, we really want to make sure that we have a value for our vendors, and we've reset it up, like I said earlier, to get our general sessions closer to our vendors, not have a lot of seating areas near our vendors. We want obviously some comfort, but we want people to engage the vendors because they make this all possible. And they have great products, and they can help you achieve all the goals that our speakers will be talking about by utilizing them. So, Steve, Donna, if you guys have anything else you want to add.
Yeah, I just want to remind people what one of the purposes of the reimbursement conference is not just to come here and find out what's happening next year, but it's a way for you to learn how to get involved with the CAA. The CAA is built upon the power of its members and its participation. Don't fly out of San Diego Thursday night. Fly out Friday instead and come to our committee and board meetings. So if you're flying out Friday, we have our committee and board meetings all Friday morning at the same hotel. We've got the CAPAC meeting. We've got a conference committee meeting where we can talk about how this conference went and what we're going to do for future conferences. We've got a content committee. We've got a legislative committee, which is super important because we've got a lot of bills we want to look at, we want to pass, we want to discuss, or bills that are affecting us. And of course, we have the board of directors meeting. This is a place where you can learn how to get involved with the CAA, learn what we are going to do next year to improve the CAA, and also provide your voice for what you want to see next year. Want to see more webinars? Let us know what you want to see. Want to see more on HR? Let us know. We don't know what you want us to build unless you're there giving us the voice about what you need to see. So we're really happy that you came and joined us for this conference to see what we're going to do, understand our purpose and our motivation. But we also hope this motivates you that when you go to the conference, in addition to networking, having some fun golfing, going to see the Dodgers get beat by the last place Padres, in addition to all of that, we want you to get involved with CAA and help us build into the future what we're going to do.
Yeah, well stated, Donna. And I just want to, as the current board of director, we've got a lot of stuff that we're looking at this year. So please, as a vendor, as a member, come to the board of directors meeting, come to these meetings. We can't improve the CAA. We can't do what we want to do unless we have input and value. And we need to make sure our members see that value. And our people who aren't current members that we want to be members. We have a lot of value together, and you said it perfectly, Donna, but I do know that this board of directors meeting is going to have a lot of hot topic agendas on it. So please don't fly out Thursday, stay Friday, and give us the input so that we can make this conference and this association the best it possible.
Kelly, did any questions come up?
Thank you, Donna. Thank you, Donna. Thank you, Jimmy. And I also just wanted to emphasize that the meeting this will be a little shameless plug for the meeting 9:30 to 10, which is the content committee. We will be discussing kind of future content for the next 12 months that are coming up, and we're also looking for additional members to that committee. So if anyone on here is interested in kind of driving the content moving forward, please show up to that meeting, and we're looking for a few more members.
So far, I do not have any questions that have been submitted. It was a great presentation, a great overview on what is to come for the conference, and we really appreciate you guys providing that expertise to our members. I can't stress enough, this is Kelly at the headquarters of CAA. Please register for the annual conference. You can do so by going to the website at the/caa.org. Register, make sure you signed up for all those sessions and participate. And like Donna had mentioned, if you can stay until Friday, please do so. We would love to see more engagement so we can get your feedback on what we can do to make the association work better for our members. Thank you all for participating today.
Thank you, everyone.
Thank you.